Hello, everyone. I am Dr. Jasmine Berry. I'm a family nurse practitioner. I recognized early on in my career that I have a passion for education and counseling, and that I do love counseling on health promotion and equipping my patients with tools and techniques to place them in charge of their own care. So, this really speaks to what my DNP project is about that I will be presenting to you shortly. I completed my Doctor of Nursing practice in May of 2021, and when choosing my DNP topic, I did want to focus on how the healthcare provider can negatively or positively affect the rates of obesity by the implementation of health promotion, health literacy techniques, and their awareness and reverence of cultural practices. Obesity unfortunately continues to be a public health issue, with Black women experiencing the highest rates. Project Black, standing for Barriers Lifted After Cultivating Knowledge, was a quality improvement project that focused on assessing individualized barriers to obesity prevention using a health literacy tool called the Teach Back method. The objectives for this presentation are to 1. Describe the 3 key actions the Teach Back method allows the healthcare provider to deliver to ensure the translation of health education was accurate, and 2, identify three techniques on how to enhance their assessment skills to identify stress, coping mechanisms, and accountability partners with the Black women doing routine examination. So, as I stated, I am a healthcare provider, so I really wanted to assess how healthcare providers can be helpful and how they can also be detrimental to an individual's health. And specifically when it comes to the health of minorities, it is important that a healthcare provider is engaged and involved by not just prescribing medications and treatments, but truly by being an advocate and tailoring interventions to decrease further health disparities. And within Black women, those disparities secondary to poor nutrition, obesity, and lack of physical activity. And as I stated, I wanted to investigate individual barriers to obesity prevention and Black women, and I did this by recruiting my sample from a predominantly Black church in Atlanta, Georgia. I put my I put my project together by utilizing a mixed methods design by using group sessions and surveys, and I did this over a 4-week time frame. As I was putting my project together, I recognized that literature stated that there were some long-term goals of decreasing obesity, but really there was no tangible way of getting there. And the solutions on how to actually decrease morbidity and mortality within obese Black women was very limited, and that evidence pointed that it was multifactorial that included engaging healthcare providers and increased and tailored education on health promotion and prevention. And that speaks a lot in my results as well. So, over the 4 weeks, I did educational sessions and they were held over 1 hour. And I addressed 4 common barriers identified in literature, which were chronic disease connection, mental health, nutrition, and physical activity. And at the end of each session, a 5 to 10 minute teach back session was utilized to correct and verify understanding, correct inaccurate information, and to reinforce the topic discussed. After taking all of my information and my data from from live sessions and surveys, I did a correlational analysis and it showed that BMI, education, and income level, there was a positive significance. And as Black women increased their education, placing them in multiple roles, the statistics showed higher rates of obesity within this population, regardless of social economic status or education attained, which what I point out again is different from literature, and that stress was the main contributor that led to disordered eating, decreased physical activity engagement, and a lack of motivation within the participants. Now, these all speak to kind of racial undertones and health inequities, and also how the interconnectedness of being a woman and a Black woman all play in together, but we can speak more about that in the question and answer session. But also that participants really voiced their increase in knowledge, clarifications of topics not formally understood, and a desire for increased quality care delivered by practitioners. So within this, I challenge healthcare providers, specifically APRNs, to utilize obesity risk and stress assessment counseling, and this really should be integrated into their toolkit and used consistently in the care of Black women, and to be an advocate in an effort to decrease further health disparities. I would like to thank my project team that's mentioned at the bottom, and I would like to thank you all for listening. If you have any further questions or would like to look at my resources and my final paper, the QR code is linked below. Thank you.